Hi, my name is Stephanie, and I was diagnosed with late-stage advanced stage 3C ovarian cancer in January. For months, I had been having all sorts of abdominal symptoms. I had been having a lot of pain, a lot of bloating, just changes to my eating that I didn't feel were normal. And I kept going to doctors, and it just kept getting missed, and so it took me a long time to be diagnosed. I was diagnosed because I had had an exploratory surgery, and once the surgeon had opened me up, he found that the cancer was all over my abdomen. Like, my organs were actually glued and fused together, and he could not even see my uterus to remove anything. So that was a very hard day, because I had found out that I had late-stage ovarian cancer and also that it was inoperable. So I was left feeling like I was basically completely screwed. I went home and started doing a lot of research. One of the first things I found out is that chemo is very limited, very difficult, and very, very scary drugs. And so I decided to kind of pursue an alternative treatment plan through a very intense diet, a lot of supplements, and unfortunately that just didn't quite do it. And I saw my tumor actually grow in those months I was trying to do only that. So eventually I started having problems with my kidney, with my bladder, and that's finally when I decided to come and see Dr. Nizami. I had found out about Dr. Nizami through an internet search when I was researching, and when I came in here I was so excited because I found books on Dr. Nizami's shelf that I had actually bought and had on my own shelves at home for my own research. So that was just a great feeling, knowing like, wow, this doctor, probably has a viewpoint maybe similar to what I found out on the internet about chemo and things like that. So I met with Dr. Nizami, and it was the first time I felt any hope, literally, because I had just been reading all this about chemotherapy and it just sounded so awful. And so I was very impressed with Dr. Nizami. I was thrilled to be here, and so I started chemotherapy. And I did a bunch of testing with Dr. Nizami to make sure it was the correct, the correct drugs, and I was so happy to have him kind of, overseeing that, to know that I wasn't going to get too much chemotherapy or the wrong type of chemotherapy, because if you do chemotherapy, you want it to be right, and you want it to be right the first time. You don't want to have to do these drugs over and over again. So I started chemotherapy as well as doing Dr. Nizami's treatment to help the chemotherapy be more effective and to treat it, just from a whole different perspective. So I started doing chemotherapy as well as Dr. Nizami's treatments, and it took about, I think, about 12 rounds, which is once a week chemotherapy, and coming here, and I was able to finally have an operation. So the cancer was, retreated back enough where a surgeon could go in and debulk me and get everything out. So that happened. I had my surgery up in Stanford, and it was very successful. So I'm on the other side of that now, kind of, just finishing up chemo, still having my treatments here, and I'm very happy to report that my CA-125 is in the normal range, just like a normal non-cancer patient person. So I couldn't be more thrilled. I just really couldn't be. In the beginning, my CA-125 was over 2,500. So to have that drop now to 20, right now I have no evidence of disease, my scans are clear, the numbers look great, so I'm very happy. Well, if I could give advice to a new cancer patient, I would say do your research. Find out about chemotherapy, find out why it's limited, why it doesn't kill off those stem cells. It's very important to know this and not just to listen to just one oncologist, because you have options. You have options that will help you. So I would insist, do all your research, find out about these drugs before you put them into your body, and I would highly recommend come and see Dr. Nizami. I believe you're going to have great results.